On a midnight shift at a large teaching hospital, a surgical nurse comes into the special care nursery carrying a stainless steel pan with a towel over the top and hands it to Nurse Jane and tells her that this is a 23-week-old baby that was born alive from a failed abortion. She's also given strict doctor's orders not to do anything other than record the time the heartbeat stops. As the surgical nurse leaves, Nurse Jane lifts the towel and she sees this premature but what appears to be a fully formed baby boy burned from head to toe, struggling to breathe. She is overcome with emotions. She's stunned in the middle of a teaching hospital with the technology and the staff, yet nothing is being done to help this little baby. She says that all she can do is just sit and stroke this tiny infant's arm. About 4 hours later, this nameless baby dies. Another location, another time, another mother. She is given a saline injection. About 18 hours later, she gives birth to a 7.5-month-old, 2.5-pound baby girl, also born alive and also burnt significantly from the saline injection. So what do these two cases have in common? They're both late-term abortions. The saline was intended to kill both of the babies, yet they were both born alive. The little boy is allowed to die laying in a pan, never feeling his mother's embrace. The little girl survived. The abortionist had not arrived at the clinic yet, and the nurse on duty made the decision to get her to the hospital for immediate care. Today, that little girl is Gianna Jessen, and she is an outspoken pro-life advocate. So these cases, you can read more about these as well as many others, babies that survived the womb, only to, in most cases, were allowed to die, or in some cases the doctor actually killed them outside of the womb. Abortion is also big business. There's some doctors that make millions of dollars a year doing abortions. So my name is Greg Holtke, and I'm going to talk to you about a little bit more about abortion and try to persuade you on why we need to stop the elective abortions or abortion on demand. So why should we do that? Well, because every year hundreds of thousands of healthy babies are aborted by healthy mothers. So what makes me credible? I've done a lot of research on the topic. I mean, I've tried to be critical in my thinking as to what's right and what's wrong, and I just don't see anything that justifies killing a baby, a healthy baby, from a healthy mother. So my thesis is we need to stop the elective abortions or the abortions on demand. That, just killing for convenience and killing for money is wrong. So is it really right? Life. There's very little argument anymore. I mean, it's a human egg, it's a human sperm. When the sperm penetrates the egg, it becomes a zygote. It's 100% human, 100% DNA. There's no argument about that in the scientific community. Human development happens very, very rapidly. At 22 days, you can detect a heartbeat. At 20 weeks, you can see the image of a baby potentially sucking its thumb, stretching, yawning, maybe even covering its ears with its hands because of external noise that's bothering the fetus, the baby. So some want to argue that the fetus cannot feel pain. It's okay. They admit that it's a baby, they are an unborn baby or a fetus, that it's alive, but they want to say that it can't feel pain. Dr. Bernard Nathanson would tell you otherwise. He is a former abortionist who said in an image, at 12 weeks, the baby will open its mouth in a silent scream because of the pain. So what is the law? Well, there's two laws that made a huge difference in 1973. Roe versus Wade and Doe versus Bolton. Prior to that, abortion was allowed in some instances, but these two cases virtually lifted all restrictions on abortion. Most people don't realize that. They think that Roe v. Wade only changed things for the first trimester, the first 13 weeks. And that's not the case. It gives the woman the right to abort a baby for any reason up to 24 weeks, what they consider to be the point of viability. The court has also ruled that the fetus has no rights. Doe versus Bolton expanded on the women's health definition, saying that that includes physical, psychological, familial, age. So if a doctor deems that the abortion is because of this so-called expansion of women's health, then a baby can be aborted from conception up until the day of birth. Now, some would argue that the fetus is not human. Kind of back to this viability. Though there's 38 states that would disagree with that have fetal laws, that if a baby is killed, an unborn baby is killed in a criminal act, then that individual can go to prison for homicide or murder. So one of the other biggest arguments is women's health. Now, they have broadened that definition of women's health, but how often is it really performed actually for the health of the mother, because it's necessary? And I'll admit that in some cases that it may be required to save the mother's life. Well, there's been several studies done over the years, one of them by the Guttmacher Institute, another one by AGI Survey, that says that less than 1% is because of rape or incest, and less than 7% is actually because of the woman's health, to be able to save the life of the woman. The vast majority of them are elective surgeries. Pro-abortionist also wants to say that you ban abortions and you're going to wind up with back alley abortions. Well, before Roe v. Wade, there were basically illegal abortions that took place, and 9 out of 10 of those were done by trained physicians, and there is no statistical evidence that there was a high maternal mortality rate. You can also look at countries like Poland or Ireland, who have almost banished all of their abortions, and their maternal mortality rates have actually gone down. There's also undeniable health effects for the woman that has an abortion. So there's a higher percentage possibility of having cervical, ovarian, or liver cancer. There's a higher percentage of overall health conditions. It's also a high likelihood that the next pregnancy would not be a full term. California Medicaid also tells us that the woman has a 160% chance increase of requiring hospitalization for psychiatric treatment after the abortion. So what is the solution to abortion on demand? It went too far. We need to stop this abortion on demand. I mentioned earlier that in some cases abortion may be necessary to save the life of the mother. We also need to look at the inhumane conditions. This saline poisoning needs to be banned or outlawed. We also need to teach abstinence. You know, in this sex-crazed world, we want to talk more about safe sex and handing out condoms as opposed to abstinence. So what will happen if we don't do anything? Hundreds of thousands will continue to die. You know, I was allowed to live. The abortionist was allowed to live. You were allowed to live. So what actions can we take? I would advocate that you become a pro-life advocate just like me. You can lobby politicians to have laws changed. You can protest peacefully. You can talk to women that are thinking about having abortions. For every baby that is put up for adoption, there's 36 parents willing to adopt that baby. Many of them are even willing to take babies with handicaps. Teach your kids and grandkids about abstinence. Be a voice for the unborn, just like me.